In this video, I'm going to discuss the guidelines on the normal range of the body mass index, the blood pressure, blood sugar, as well as the lipid profile. Now, regarding the body mass index, it's being calculated by measuring the patient's weight in kilogram divided by meters square of the height. So let's say that the patient has a 100 kilogram weight and a height of 2 meters, so meters square of 2 meters would be 4 meters. So therefore, the body mass index would be 25 in this patient. Now, the normal range for a body mass index is 18.5 to 24.9. So here I just rounded the numbers, but the actual value should be 24.9, 29.9 for overweight, 34.9 for the class 1 obesity, 39.9, and so on. So for the normal range, it's 18.5 to 24.9. If a patient has higher than 25 up to 29.9, that would be considered overweight. And then if it's between 30 to 34.9, then that would be considered as class 1 obesity, and so on. And then finally, less than 18.5 would be considered as underweight. Now, regarding the blood pressure, the normal range is less than 120 millimeter mercury systolic and less than 80 millimeter mercury diastolic. Pre-hypertension is considered between 120 to 139 over 80 to 89 millimeter mercury of systolic over diastolic. And then for hypertension, anything over 140 systolic or 90 diastolic would be considered as hypertension. So, do you know what is the goal for blood pressure in the diabetic patients? And so, for the past few years, research studies shows that the goal is less than 130 over 80 millimeter mercury. So while the pre-hypertension is considered 120 to 139 over 80 to 89, for diabetic patients, the goal is to keep the blood pressure less than 130 over 80 millimeter mercury. Next, we have the blood glucose. Now, blood glucose can be measured in different values. One is millimolar divided by liter, or the other value is milligram divided by deciliter. So first, I'll give you a memory aid to help memorize the numbers in millimolar divided by liter, and then help you to calculate the values in milligram in deciliter next. So for these values, at first it may look confusing, but it would be very easy if you memorize the phone number that I've provided here. So the memory aid says memorize pre-diabetes phone number, which is 567 area code 78111. Now, the first bracket, the area code, is for the fasting blood sugar. So for the fasting blood sugar, 5.6 to 7. So 5.6 to 7 is the pre-diabetes number. So any value that falls between 5.6 to 7 is pre-diabetes. Values less than 5.6 is considered normal, while values higher than 7 is considered as diabetes. And then for the random blood sugar, the next values come in. So 7.8 up to 11.1 would be again the pre-diabetes number. So 7.8 to 11.1. So any values that fall between these range is considered as pre-diabetes. Values that are less than 7.8 are normal, while values that are more than 11.1 random blood sugar is considered as diabetes. Now, if you're planning to calculate these numbers in milligram per deciliter, all you will have to do is to multiply the numbers by 18. So for instance, 5.6 times 18 is equal to 100, while 7 times 18 is equal to 126. So if a fasting blood sugar is between 100 to 126 milligram per deciliter, then that's pre-diabetes. Values higher than 126 is diabetes, while values less than 100 on fasting blood sugar is considered normal. Likewise, for the random blood sugar, multiply these numbers by 18. So 7.8 times 18 will give you 140, while 11.1 times 18 will give you 200. So values for the random blood sugar that falls between 140 to 200 is considered as prediabetes. more than 200 is considered as diabetes, and less than 140 is considered as normal. And then for hemoglobin A1C, the pre-diabetes range is 5.6 to 6.5. The values less than 5.6 are considered as normal, while the values more than 6.5 are considered as diabetes. And then finally, we have the lipid profile. So the goal for the cholesterol is to keep the cholesterol less than 200. For HDL, it depends whether the gender is male or female. So in females, the goal for HDL is more than 50, while in males, the goal is more than 40. And then with the LDL, it depends on how many risk factors are present. So the risk factors that can determine the goal for the LDL include the cigarette smoking, age of more than 45 in males or more than 55 in females, blood pressure of more than 140 over 90, which means hypertension, and then HDL of less than 40, and then family history of premature coronary heart disease. Now, if there is 0 to 1 risk factors of the ones that are listed here, then the goal is to keep the LDL below 160. If there is 2 or more risk factors, then the goal is LDL of less than 130. And then if the patient has either diabetes mellitus type 2 or coronary heart disease, so if the patient himself or herself has these conditions, then the goal is LDL of less than 100. And this is actually a very important concept, particularly for step 2 and step 3 USMLE exams. And that concludes our discussion of this video.